The United Health Foundation recently released the America's Health Rankings 2022 annual report that highlights improvements, challenges, and disparities when it comes to the well-being of Americans across all 50 states. Ohio ranked 37th on the list this year. And today, Dr. Ravi Johar, Chief Medical Officer for UnitedHealthcare, joins us to tell us more about these findings. Welcome, Dr. Johar.
Thank you so much for having me.
So tell us about the America's Health Rankings 2022 report. What's in it?
Sure. America's Health Rankings is a report that's put out as a joint project between the United Health Foundation and America's Public Health Association. This is actually the 33rd year that America's Health Rankings has been produced, and it gives us a really good snapshot of how our community fares in relationship to other states and the District of Columbia, and areas that we are doing very well in, areas that we may have some areas of opportunity, and just gives us a chance to look to see what other states are doing well so that we can learn from them and to share some of our best practices with other states.
So what was the most notable finding in this year's report?
Well, this year's report was unique. This is the first report actually that's taken into account the COVID pandemic. So we're looking at data that includes what's happened during COVID. And one of the things that was most striking to me was that for the first time in the history of America's Health Rankings, the premature death rate has actually gone up. Now, the premature death rate is the people that are dying before we think they should based on age and other medical factors. Now, there's three things that go into that. One of those obviously is COVID, but another one was firearm deaths have gone up by 17%. And the most dramatic and shocking one was that drug deaths have increased by 30% in 1 year alone. That's just devastating.
Well, that really is devastating to hear. So what can we do as a community to help?
Well, obviously, the first thing we want to do is try to prevent drug overdoses and prevent drug usage. And that's an ongoing thing. But the other thing we can do is recognize that it exists and start utilizing some of the medications that we have to help combat. Things like Narcan, which is immediate treatment for someone that's suffering a drug overdose. A lot of health plans are covering that. It's available. I know UnitedHealthcare, for example, is making this free of charge to any of its members. There's no cost to have this Narcan available. And if you see someone that you suspect is suffering from a drug overdose, giving them a shot of that can just be life-saving. So I think it's really valuable that we can think of it in our communities.
And what are some of the other findings in this year's report?
Well, there's some other things that are really interesting. One of those is that important is that the percentage of people that have access to high-speed internet has gone up. That's really important, especially in this age of telehealth and remote treatment for things. So I think that's something that's really beneficial. Another thing that's really exciting is that we've actually had an increase in the number of primary care physicians and also in mental health providers. So I think that's something that's really critically important. Another thing that's interesting from COVID is that this study found that up to 30% of people that have had COVID have symptoms of long COVID. Now, we think that's a rare thing, but when 1/3 of the population has that, I think that's something that really bears looking into. So I think those are some really good positive things that came out of this report.
So what did we learn about Ohio? What were some of the biggest strengths and weaknesses?
Sure, Ohio has areas where they're doing well and other ones that are certainly areas of improvement. One of the things that we found in Ohio was that food insecurity actually decreased 36%, which is great. And obesity, unfortunately, rose 27%. Suicide decreased by 10%, which is great. The high prevalence of frequent mental distress, now that's defined as people that report that they're having severe mental issues more than 14 days a month. They ranked very, very high in the country. I think 47th in the country for that. On the flip side of that, there's a high supply of mental health providers in Ohio. So that's really good from that standpoint. And there's a real low percentage of households experiencing severe housing problems. So I think there's some really good things that are going on in Ohio also.
And Dr. Johar, what can community leaders, policymakers, and healthcare providers do to improve our nation's overall health?
Well, I think that's the whole purpose of this report, is to look at it and to see what areas you're looking at in your community that you want to focus on. Every community is different. Every state has different issues, different priorities. And I think being able to focus on areas, I think Ohio shows a good example. They saw a lot of mental distress and they've increased the number of health providers. I think that's fantastic from that standpoint. And that's the kind of thing we want to do. Not compare yourself to see how you rank next to other states, but what states are doing well in an area that you want to work on and learn from that and be able to share your practices. I think this is information for our political leaders, our public health officials, to really look at and evaluate and see how their state is doing and where we have a chance to really improve.
A lot of great information there. So where can we go to read the report and learn more?
The best place is to go to something called americashealthrankings.org. It'll let you break it down by state, even within a state, and really compare a lot of data. There's a lot of information there that can get into. You can also get to it by going to uhc.com and looking for America's Health Rankings on that. So those two websites will be fantastic.
Well, Dr. Johar, thanks again.
Thank you. It's been a pleasure being with you.